Good evening. I see Alan, you're on. All right, we'll be starting in a couple of minutes. Good evening to everybody as people join. We'll be starting in a couple of minutes. All right, so we can begin. I think there's a few of us on right now, and other people can join us. Good evening to everybody. Perhaps if you're good with it, you can just unmute yourself and let me know where you are, what clinic you attend, if any, and a little bit about yourself. So anybody can jump in first. I think Alan, you were on first. Maybe you can tell us a little bit about yourself. And Alan might be away. And then we have, is it Al?
Good evening, Dr. Vikas. How are you?
I'm good. How are you doing?
Good, good. In brief, I went through chemotherapy about 6 months, 3 months for radiation. Now I don't feel my foot at all, totally numb.
Okay. Well, thank you for sharing that. I'll definitely touch on that in my
Thank you.
presentation. Have you been to
Thank you.
one of our clinics yet for treatment?
No, no,
So I'll speak to you about that then
sure.
through the course of this webinar. Okay. All right, so let's begin. And it's good to know that there's some new people as well as obviously our loyal clients. And so let's talk a little bit about from the beginning. What is Intelligent Health Group? Who are we? What is our mission? Our mission is to basically make people happier and healthier. It's as simple as that. Just make people happier and healthier. And how do we do that? Well, we do that through our clinics. The reason my wife, Dr. Bajaj, and I started this practice, and we've been practicing over 20 years now, is for this reason. And we want to make sure that people are getting a comprehensive solution that actually addresses the root cause of the problem. And I know a lot of people say that, but they don't do it. But we do that. And we do it in a very specific way. We have a specific protocol, process we follow. But what we try to leverage is the newest science, the latest evidence-based research. We try to make sure we're at every conference, and we're always trying to make sure that we're up to date with what's happening, how we can help people. And this thing that Mr. Al talked about is one of the things that we actually are very proud of. We have three main signature systems in our clinic, and they specifically revolve around neuropathy. So neuropathy is where the nerves get damaged and you can't feel whether it's your feet or your hands or simply there's a lot of burning in your feet or hands, especially at nighttime. It wakes people up at night. It's terrible. And this can happen from various reasons, right? Like whether it's diabetic neuropathy or chemotherapy-induced neuropathy. So after you have chemo, your nerves can actually start to go into a coma-like state, right? Dead, so to speak. And that is something very common. We also get with alcohol-induced neuropathy. A lot of people that have been alcoholic, that can happen as well. And there's certain medications like statins, cholesterol medications that can do that as well. So we have protocols now to reverse that. Before last year, so we've been doing this now for about a year and a half. Before that, there was no known solution for this. It was just managing pain. It was a symptom management. But now we have a way to actually reverse that and cure the problem, which is amazing. It's been fantastic to see. That's something we're very excited about because we've just seen amazing changes, people's lives change, and that just brings us so much joy. The other main protocol that we do, the second of the three, is called spinal decompression. That's something we're very proud of. Our spinal decompression protocol is the most comprehensive in the market. And what we do with that is specifically for people with disc problems or sciatica, pain down the legs, that's originating from the lower spine. The spinal nerves can get compressed and pinched. So our technology is there to actually open the space up, take pressure off the nerves using our specialized computerized machine called a spinal decompression bed. And what we do, what the recipe I've created myself, is we also incorporate three different things to enhance the effect of that treatment. And so I'll be talking about that, in a moment. And the third thing that we're most proud of is our knee decompression technology. So we're with knee arthritis. So again, in short, neuropathy, spinal, problems and diseases, and then knee. These are our three main signature systems that we use as part of our chronic pain programming, which is kind of what we specialize in. So the way that our treatments work, and I'm just going to bring up the page to show everybody, is we have the signature system. Okay. So our process involves three stages of treatment, no matter what problem people come to us with, whether it's a knee problem or a nerve problem, spine issue, or anything else, because we obviously take care of every muscle, joint, nerve issue, as well as just keeping people well. We do that too. So all people, though, regardless, follow through in this three steps. The first step is obvious, right? It starts right at the bottom. This is the road to recovery. You start here. It's all about relief. So if you have pain, we start you here. It's all about getting you out of pain, reducing inflammation, reducing the symptoms. Once we can get you over this threshold, this dotted line here on this chart, then you're not really feeling pain anymore as much, or in a much more reduced fashion. You're now above that line. And now we can really start going to work. We can start going to work on improving your function, your overall health. We can start improving on that. So how? So this is where you're going to get more lasting results. We're going to now work on creating more flexibility through the spine, for example, working on more strengthening. We can work on getting you to more of a stable level. If it's an organ issue, it's all about making sure that it's starting to, function at a greater level, at a more lasting level. The tissues are actually repairing. This is more of a repair zone. In neuropathy, this is also more of the repair zone. It's not about inflammation pain anymore. Now it's about repairing the nerve and making it come back to life. So this is the second phase of care. And then the last phase of care is just maintenance. Like anything, like going to the dentist to keep your teeth clean, you need maintenance. Like going to the mechanic and regularly getting your oil changed, that's maintenance. Same thing here with our body. We need to maintain this physical frame. So regular periodic treatments to make sure the problem doesn't come back is something very important. And again, this is something a lot of people miss. A lot of places you go, they just do some quick treatment, symptom relief, and then you're done. But then what happens is, as this chart shows, after some time, your problem comes back. You relapse, and then again, you do some treatments. Again, you think I'm fixed. And then again, you're back to the bottom after some time. And instead of going through this roller coaster, it's really important we educate you that you have to go through this healing phase, this restoration phase. Okay. And once we can restore your function to a better level, then you can get more lasting results through the ongoing maintenance care. So this is our signature process that we basically put people through and educate them through and graduate them through these different levels, these different stages, stage one, two, and three. And that's the IHG process. And we do that through everything. So now I'm going to speak a little bit about what makes our programming unique for those three signature systems that we talk about that are neuropathy, spinal decompression, and our knee decompression. Okay. So with the knee, this is our newest program, right? That we just launched this year. We're almost reaching our 1 year anniversary. So with the knee problem, before again, it was all about just managing the symptoms, that the space between the knees gets less, bone on bone starts to happen, you start getting into a lot of pain and inflammation. And so it was all about just managing pain before. Putting an ice pack on it, putting some compression on it, maybe wearing a knee brace, and that's all we could do. Uh, at least in the rehab world. Obviously, in the medical world, there's always surgery, right? Getting a new knee replacement, etc. But that doesn't always work the best. And there's a lot of recovery time in it. So, how can we work with your own body to try and stabilize it to a sense that you can push off surgery, you can become more mobile, and you don't have to be as bothered by your arthritis? So, for that, we have four things that we put together. We have a machine now. It's called the Neon Track. You go in it, and again, it decompresses the knee joint. It actually opens the space apart. And then we do a laser enhancement. We actually shine healing light into the joint, and it brings new, healthy blood flow into the area. It helps to hydrate the cartilage, the cushioning in between your bones, and it immediately starts to bring down inflammation, which then brings down pain. And by doing that program, in conjunction with two other things. One, horizontal therapy. Horizontal therapy is amazing. That technology for the knee can be used for bringing more fluid into the knee joint. Okay, it actually restores and regenerates new healthy knee fluid into the joint. New technology, again, I think we're probably the only ones in Canada having it because I personally brought it from the US this year. So horizontal therapy. So the laser and the knee decompression, the horizontal therapy, and of course, me as a chiropractor, us adjusting the joints, like the knee joint, creating more movement in the joint itself. These four items are what constitute our knee program. Of course, we'll recommend what kind of supplements to take, like Genacol is a great one. It has glucosamine, it helps build cartilage. We'll tell you about that as well. We'll show you what exercise you can do, whether it's here in our gym or at home, simple things to, again, support the whole healing process. Of course, we'll tell you other assistive devices you can also use as aids, whether it is braces or orthotics, etc. We'll tell you all about all that. It's not that we're going to ignore that. But from a service perspective, those four things we would actively do on you to help with healing and to stabilize your arthritis so that it doesn't progress and you're more mobile, you can move your knee more, you're in less pain, and we can push off that surgery. That's what we can do for the knee. Okay. Similarly, with the spine, the spinal decompression program, it's the exact same thing, the same four things, but we use it on the spinal joints instead of the knee joint. So that's why we would use the spinal decompression bed, not the knee decompression bed. But same process, right? Same philosophy. You want to open the space up. You're going to separate the bones apart. You're going to get blood flow into the area. You're going to use the horizontal therapy to help with healing of the nerve tissue, okay? Where that nerve tissue has been damaged in the spine. You're going to use a laser to bring blood flow in the area, right? You're going to do the chiropractic adjustments. Those are the four things we do. Okay. And yes, we do that throughout this process. So if you look at this chart, if you look here at day one where you're in relief, this is days. Within days to weeks, we can get you pain relief. Again, that's not the hard part. The more part is where we're doing the corrective and the restoration, right? The healing. And healing takes time. That'll take months. It takes a minimum of 90 days or 3 months to start seeing that type of lasting result, this functional change here, this restoration of the tissues, this more lasting change. You're going to start seeing after 90 days. Here, as we showed you before, it's temporary. The problem comes back. But after 90 days, you start to stick more. Okay? You start. So it doesn't mean that's the end of the journey. For some people, if you're lucky, if it's a simple problem, it is. For other people, it takes longer. But certainly it takes minimum that much to get more lasting change in chronic issues. Now, um, in the spine and the knee, like I talked about, you would go through this process. Both of those systems, you would follow through here. And the first thing you're going to notice is symptom relief, and then you're going to start seeing those changes in conjunction with you doing things at home, like we tell you, like simple exercises and so forth. You'll start seeing lasting results. Now, after that, we can just put you in a simple maintenance program. Usually, it's a bi-weekly maintenance. That's what we do. And arthritis or a chronic issue, that should be good enough to keep things in check so you don't lose any of the benefit you've got so far. Functionally, you're as strong as you were when we finished. That's really important. Again, if you leave the body and let just do its own thing, then aging continues again. Of course, you'll go backwards. Now, let's talk about the last one, the neuropathy. Okay, I know Mr. Al talked about chemotherapy-induced neuropathy. So it's the same as diabetic neuropathy. They actually function the same way. What happens is, as I mentioned, that the nerve fibers, specifically the sensory part of the nerve, not so much the motor part, the strength can still be there, but the sensory part goes down. So when we do examinations, we check with pinprick, we check with vibration, we see is it the same on the left and right? If it is, then it truly is more of a what we call a blood-borne issue. So it could be from chemicals like chemotherapy, it could be hormonal like with diabetes, but that's what's happened that the nerve fibers have started to die. So then we got to do a regenerative process, right? We got to use regenerative medicine. And that's where the recipe I've created is amazing. So we use our class 4 healing lasers. That's the prime hero of that movie. It's going to bring new healthy blood flow to the nerves in the feet, and you're going to start getting the nerves to start to heal. Okay. Now, to accelerate that, to optimize on that, we use that horizontal therapy I told you about. It's a bioelectric therapy to stimulate the nerves to wake up and come back to life. And so the combination of the laser and that is very powerful. Those two things alone pretty much account for the healing. Now, in addition, we would tell you what vitamins and supplements you can take that are good for nerve health. That'll be important. We'll, give you that. And then, of course, the chiropractic treatments, like I keep saying, that's important because the nerves originate from the spine. So very important that you don't have any undue pressure or stress on those nerves that as they exit the spine. And that's what the chiropractic treatments would do. It would make sure that you have optimal nerve flow from the spine out to the feet. So the chiropractic, the horizontal treatment, the laser, and any little recommendations for home will solve the neuropathy. And we've had great success with that. And so all of those processes, including neuropathy, go through the system, the three phases. Okay. Usually with neuropathy, we can get to a maximum recovery within the 24 visits. I told you with the spine and the knee could be more than 24. With neuropathy, it's not. Neuropathy, actually, we can fix very quickly with our system. So it's the least of the evils. So what Mr. Al is dealing with is more of the simpler issue. The other two issues are harder because the neuropathy, we always see maximum improvement within 24 visits. You don't need anything more than that. Then you can go straight into your maintenance programming at that point. So this now brings us to why we came together today, which is about our Black Friday special. Okay. And this is a why I'm so excited about it too. This is the other reason. because I've never done this. We've never done this before. But we wanted to do something special because there have been people recently, I think it's because of the way that times are tough, that people are suffering. They want treatment, but they can't afford it. Plain and simple. I mean, that's the reality. And the way things are today, people just can't afford treatment for themselves. And that is heartbreaking for us because remember, our mission and vision is to see people happy and healthy. So we feel already always our hands are tied a bit when we can't help somebody because they're not in a position to help themselves. So that's always been kind of on our mind. Obviously, Black Friday is a special time once a year where, you know what, they're almost the expectation is you can and should do things, really amazing things for people. So we said, you know what, let's do this for the community. Let's open up 10 special spots per clinic. Obviously, we can't handle more than that, and obviously it would be a loss to us if we did that because we were taking a loss on it on the program. We were trying to just make up a minimum amount on our expense and that's how we priced this out. But we gave a 70% discount on our comprehensive solution. 70% discount. And for people that have insurance, it's structured in a way that yes, you can get all your money back from insurance. And if you don't, then even more importantly, this gives you the accessibility to get into the program. And so we're going to go into that. So that again is the why as to why this how this came about. And yes, of course, after Black Friday, it will be gone. We won't be able to do this again. And maybe next year we can do something in a different format, but it would never look the same. And it can't. And you'll see why shortly. But yes, this is called the Functional Restoration and Longevity Package. So as I mentioned to you before, this program will take you through all three phases. You will get through the relief, you'll go through the restoration phase, and it'll get you into that maintenance zone through this package. A lot of people, they often tend to get out of pain, and then because they're feeling okay, they stop. And mostly it's because again of expenses. They're like, well, I don't have insurance anymore. I don't have that much money. I spent it all now on getting out of pain. I think I'll just try to manage and see what happens. And then they stop. And then, of course, yes, the pain comes back and they come back to us, time and again. And there's no lasting result that way, right? So let's get into what's included in your package. You will get your 24 visit package. So for neuropathy, that's your whole program right there. Okay. For knee decompression, for spine issues, or any other issues, again, I want to remind you, like obviously, aside from those key signature programs we have, you have your regular posture issues, postural issues. You have wellness things where people just want to come keep their healthy spine. They want to, improve things. So they go through the quick 24 visit process and they go right into maintenance. So for everybody, your initial 24 visit restoration program is included. That value is 3670 normally, just for that. Just for number one point, that usually is $3,670. Next, as I mentioned, all the chiropractic treatment will be included in this program. So during this 24 visits, you're going to get your chiropractic treatment included. 24 visits of chiropractic normally is close to $2,000. But in this program, obviously, it's included. So you're getting your restoration package. So for example, with neuropathy, you would have all your neuropathy treatments and you would have all your chiropractic treatments all included. Now, this again is where things get exciting. And we specifically put it in a greedy manner because we want people to stay well. We don't want them to have the problem come back. So we said, you know what? People need to have maintain themselves. We don't want that they stop maintaining themselves again because of money or because they think that they're fixed. We don't want the problem coming back. So we're going to give them one free year of maintenance. And so that means the additional 24 visits bi-weekly, as I mentioned. Bi-weekly maintenance is good. So if you're visiting us every 2 weeks, that would amount to about 24 treatments for the year. So that whole almost 1 year of 24 visits is included. So you have your 24 visit program, then you have your 24 visit of maintenance or a full year of maintenance included. And we've only gotten to point three, and there's 6 points here. The next thing that we do is devices. Again, we know that if people don't have the right assistive devices, that the problems can come back too. Yes, we're doing treatment. What are the assistive aids? What are the modalities they're using at home? How are they equipped with things so stress and strain doesn't again come into the body, that the problems don't come back. So custom orthotics is the most important because it stabilizes your foundation, your feet. If your feet are a little bit off, the arches are lower on one side than the other, your flat-footedness, anything like that, your whole posture shifts and there's stress on your spine, stress on your nerves, and damage can happen again. In neuropathy, of course, when you can't feel your feet very much, very important that you have good diabetic or orthotics. It's a foam and it's very protective against those sensitive feet. Okay. It's very important that you use that. So that's custom orthotics. That's included in this program. That's a $500 value right there. Okay. I told you again as well, maybe didn't mention the value of the maintenance plan, but yeah, the maintenance plan, of course, another 24 visits. That's of course another 3670 of value there too, just like that original 3670. Now, we absolutely will do progress exams along the way. Actually, that's something that makes us special too. We're not just going to blindly go through treatments and not see results. We're definitely not going to wait till the end of the day and say, okay, we did all the treatments and now you're not better. No, we would never let that happen. We always have milestone markers. So every time you go from one stage into the other stage, every 12 visits, in fact, we are going to do a progress exam. We progress exam everything. We measure. Are you improving? Is there improvement? Do we have to change the treatment? We will immediately pivot and change the treatment. We're going to ensure that there's success. If we see that nothing is working and it rarely has ever happened, then we will discharge right away. We won't progress. Okay, that's very important. That we will make sure you get to wherever you need to go to get the solution you need. But luckily, we are very excited and blessed because we actually solve pretty much all the problems, and we never really have to send anybody anywhere. But we definitely pivot and change treatments if things aren't working, and that's how we make sure we get people well. Now, the progress exams, of course, have a cost associated with them. When we are doing this program, all your exam fees are included. So in the first 24 visits, there's two progress exams. In the next 24 visits, there'll still be two progress exams, one every 12 visits. They will all be complimentary and included in this package. The next device that's really great and it works in all parts of the body, no matter if you have a nerve problem or if you have a spine problem or a knee problem or anything, or if you simply have tension in your shoulders, like all of us do. A home TENS machine is fantastic for pain relief. Okay. It's an electrotherapy, helps with circulation, reduces muscle tension. It's fantastic. Again, that's a $500 machine that's included in this program. So if you add up all the values that we talked about, what each thing is worth in real time, that's over $10,000 of value. $10,090 is what it comes out to. That's what we're talking about. Obviously, if you have insurance, insurance doesn't cover this. Insurance is very limited. Most people's insurance covers $500 of chiropractic treatment, $500 of physiotherapy. It covers maybe $500 of orthotics, maybe $500 of TENS machine. So that would be $2,000 of this covered. That's it. The other $8,000 you would pay. But with this Black Friday offer, let me show you what the investment options are. You can get the whole program for $29.95. That's what I meant by over 70% discount. Over 70% off, so now your program is only $29.95. So now you think about that, and that's how the insurance can pay all of it back. So if you have insurance, let's get right into that. People are like, well, how does it work with insurance? Okay. So like I said, your insurance usually covers $500 of chiropractic, 500 of physio. We have 5 weeks left in the year. You start coming to us. Our treatments are 150 per visit, for example. You're going to go through that 500 very quickly. Within like 4 visits, you'll be done. And then you next year starts. So anything after you're done in the next couple of weeks, everything becomes complimentary treatment. We don't start, again, charging down from this credit, this retainer, until your insurance starts again in January. Then we again start credit our billing off of the credit. And we keep billing until again your insurance maximizes the $500. So the 500 for this year that's left, 500 for next year for both chiro and physio becomes $2,000. 1,000 between chiro physio this year, 1,000 between chiro physio next year. That's $2,000. And then as I mentioned earlier, your TENS machine and your orthotics are each $500. So look, that's 3,000. And that's how we have put that price together so that all your insurance gets covered. Between this year and next year, the standard regular policies that have that amount um, ensure that everything gets covered. And that's the beauty of it. You get everything reimbursed over time. So that's the other question people have been asking me over this last few days that we've released this. Okay, I understand that you're saying comes back, but do they pay me back right away? Or how does it work? How is the billing going to work? So the way it works is, again, this is a retainer. You're only putting a retainer down. Just like when you go see a lawyer, you put a retainer down and they start billing off of the retainer. Same thing with us. You put a retainer down, we start billing off of the credit. Each time we bill for the service that's rendered. Every time a service is rendered, it's eligible for reimbursement. So we would bill the insurance and the insurance would pay you back directly. It wouldn't pay us, you've already paid us. So the money would directly be reimbursed back to you after every service until, as we mentioned, your insurance is maximized. Okay? And that's all that would be. And then so eventually your insurance would pay back this full amount based on what we talked about. And anything over and above, we're doing free, complimentary to make up that $10,000 of value. We are doing $7,000 of treatment and services for free. In other words, we're subsidizing it and you're only taking care of 30% of it and we're taking care of 70% of it. That's the ways to look at it and understand it. Yes, there are three different investment options too. Because for some people, still 29.95, we've seen there's a few people that for whatever reason they can't do that. They can't put 29.95 on a credit card. They can't get a line of credit for 3,000. Like they're below the that certain line where they even qualify for any sort of like loans or anything. Or they just literally don't have any 3,000 in savings or nothing. There's people like that, and we respect that. So we've made more accessibility for that. We're allowing people to pay in two installments or even three installments. Yes, as you go into installments, the overall cost gets a little bit higher, but it's very small compared to the comfort of paying in installments if you're in that situation. So some people it gets very comfortable at three installments, for example, to just pay $1,100 a month for 3 months. It goes with the cash flow. And still, even at 35.94, often with your insurance, you're still getting fully covered, depending on your insurance. Okay. But definitely there's more of a guarantee of your insurance covering everything on the one payment. But still, even with three payments, it's only 35.94. And so yeah, most chances are that it can get covered. Now, if you do pay as a one time, there is a bonus, of course. The bonus is that you do get cervical water pillow, the most researched pillow on the market for neck pain, for neck support, is what we call the ChiroFlow pillow. It's number one in chiropractic research. It's $125 value that's included complimentary as a gift for those that are able to do as a one-time payment, and uh, and that brings you even more value. So again, there's some people that have been asking too that they're already in programming, that they are already in this road to recovery. They maybe are here, maybe they're even here. Some of our loyal patients, they go like, can we still take advantage of this? And of course you can. Remember, this is 48 treatments, and we can absolutely customize and tailor where you're at in your journey to the program and make sure that it takes you to wherever you are now to wherever we need to be, which is ongoing maintenance. So regardless, you'll be able to use it. Uh, Conversely, the people are at the very beginning of the process. They're like, well, what if I need more than 24 visits? What if I can't graduate to maintenance yet? What if I need more here? So, like I said, we're happy to customize that. That's not a big deal. It's 48 treatments you're allowed in this program. If I have to change the frequency to suit your needs, of course we will. We will give you your most ideal dosage of treatment. We won't shy away from that. We won't cheat you of that. You deserve your proper dosage, and we'll keep you on your proper dosage, but you will get your full 48 visits. Not to worry. We can customize that. Those are some of the more regular questions we've been getting. Yes, if you're already in a prepaid program, as soon as that's done, this locks in this price for the ongoing care. So not to where you're not losing any of the opportunity, just because you're right now already in the middle of a prepaid program. You finish your program now, and then you'll be able to continue on in your next phases of care with this package, and it'll begin at that point. So again, what makes this offer different is very clear. Obviously, the price point is the biggest thing, right? But from a clinical perspective, this is going to help guarantee more that you're not dropping off care, that you're getting through the three stages of care, you're going into maintenance, and you're basically going to get lasting results. That's what this is allowing and providing accessibility for. It's going to prevent flare-ups that way. If you're maintaining yourself, you're not going to flare up as much. You're actually going to get stronger over time. It's an anti-aging because if you're getting this active care, you're slowing down progression of arthritis, degeneration. Um, you're going to feel more youthful. There's going to be better vitality. This is all the things that we're able to ensure by having more lasting care accessible to you at a very low rate. So then that there's no barriers to having that longevity, that maintenance treatment. So again, pain relief is all about ease, but this functional restoration is what gives you lasting changes. In other words, gets you your life back, which is the best thing. And again, for us, that's what gets us most excited is when we see people's lives really change. That's what makes us excited. So, yes, of course, because like I said in the beginning, there is obviously a limited availability for this because we obviously can't afford hundreds of people going into this. Obviously, it wouldn't we would lose money. But we were able to say, you know what, we're going to gift each clinic, each of our 5 locations has been gifted 10 vouchers to give and to sell this for. So depending on which clinic you're going to, depending on what numbers they're at right now, you still may have time to pick up one of these VIP upgrades. Okay. This is until Cyber Monday, so it would be Monday at midnight, and then the offer obviously is done. And once it's gone, it's gone, and that's definitely going to be the case. A couple of last questions in terms of my Q&A that I've just been noting, some common questions before I open up to anybody else is do I need a medical doctor note for the products mentioned? Of course, yes, of course you do. The orthotics and TENS machine. Yes, people have mentioned that their medical doctors ask for money for their doctor notes. And of course, if you're in our package program, we will take care of that. We already have medical doctors on staff. So they will provide the note for you when you're in this program. So you don't have to pay them anything for that. Okay. The medical doctor note would be provided. Um, People have asked if they have deductibles in their insurance. How does that work? Uh, like I said, your insurance will pay whatever it pays. So whatever the maximum amounts are that they pay will be put toward this. And yes, of course, if you're doing that one-time payment, it still comes out that you will be ahead. So not to worry about that. Um, and of course, even if they have maximums, I told you earlier, uh, it's still okay because the cost is so low, you will still be able to get everything back. And that's most policies. Of course, we can't make a blanket statement. Some people have really, really poor insurance, but I'm talking about like 80% of the people out there have a standard policy, and that has the coverages I mentioned earlier. What else? And of course, we talked about customizing your plan for frequency, etc. Of course, we can customize this a little bit more to you and your needs. And then when will the deal happen again? I mentioned that it's not. going to happen again. So hopefully that answers some questions already that you may have had. But otherwise, if there's still any questions, now is our chance for a live Q&A. So I can go over your specific situation and help you understand this better and see if it's a good fit for you. So we can start. Mr. L, did you have a question? No question? Okay. Alan, I wonder if you're on now. Happy you joined us. You can let us know if you have any questions. Okay, perfect. So if there's no questions, hopefully I did um, resolve most of those questions. If you do, of course, you can always reach out directly to the clinic closest to you, and let them know if you have any questions, and then we can have our staff answer them for you. If you need to get a hold of me, you can certainly do that through any of the clinics as well. They can always connect you to me. So with that, I hope that this is something that's going to make life a lot easier for all of you, and we look forward to seeing you in our clinic. All right. Well, have a good night, everybody.